Hello, I'm Ariana DeAngelis, Training Manager for the Autism Project in Johnston, Rhode Island.
And I'm Chris Tardy, Captain of the Lincoln Fire Department in Lincoln, Rhode Island, and a board member of the Public Safety Special Needs Coalition.
Getting into an ambulance can be quite frightening for anyone. For an autistic patient, the experience can be exceptionally difficult. There are so many components at play, each of which has the potential to cause challenges for the patient, the family, and the first responders. So let's talk about some of those challenges as well as some tips for navigating them.
It all starts with the arrival of the ambulance. Typically in an emergency situation, an ambulance arrives on scene with flashing lights, blaring sirens, or both. Many autistic patients have significant challenges with sensory hypersensitivity, which means they may be more sensitive than you or I to things that they see, hear, smell, taste, touch, and experience. This sensitivity may lead to overwhelming feelings of anxiety, pain, or might even trigger a fight or flight response. So whenever possible, arrive on scene without your lights and sirens on.
There may be more subtle input that can cause an equally debilitating response for those who are sensitive to it. Small blinking lights, beeping noises, shiny badges, reflection from hubcaps, feedback from radio, unfamiliar voices, sunlight, and even the sound of flowing oxygen can be overstimulating for some. Try to reduce any stimulation as much as possible. In addition, some autistic people are very sensitive to texture and touch. The feeling of a Band-Aid or bandage on their skin may be extremely overwhelming or upsetting to some people. Even the feeling of someone touching them, however lightly, can be really difficult or impossible for the person to tolerate, so minimize touch whenever possible.
If you do need to perform a physical exam, move as slowly as you can. Perform the exams distal to proximal. Explain calmly and slowly, with as few words as necessary, what you are doing with each step. If you need to use gestures, make them as non-threatening as possible. You might also consider, if time allows, writing out a quick checklist of the steps on a whiteboard. That way, if the person has trouble processing verbal language, they can follow the steps by reading them. Cross off, check off, or erase the steps as you go.
When you arrive on scene, if there's a caregiver present, make sure to ask a few key questions. Those questions include: how does the patient communicate? Do they use spoken language, symbols, sign language, or a communication device? If the patient uses symbols or a device, are those tools available to provide to that patient in that moment? Also remember that some patients who communicate verbally are not able to do so in high-stress situations. When you arrive, the patient may be able to speak to you, but then may lose that ability as their anxiety increases. Be patient and allow ample time for the person to answer you. They may need 15, even 30 seconds or more in order to generate a verbal response.
Also, if there is a caregiver or partner present, ask them how the patient typically reacts to stress. What triggers a stress response? If we know the patient's triggers, we can do our best to avoid them. What usually helps to calm the patient? What are their favorite shows, movies, characters, songs, or hobbies? For example, if the patient likes Minecraft, you may be able to talk to them about it in order to calm them down and distract them.
Many autistic people find great comfort and stability from routine and predictability. Changes to that routine and unknown or unpredictable situations can cause extreme anxiety. The patient may be very anxious to get out of a stress-provoking situation, like being placed on an ambulance. They may report that they are fine or okay, even if they are not, without being aware of the health and safety implications of doing so. Please be extra vigilant in your exam of the patient to confirm what they have reported. Make the experience as predictable as you possibly can. Consider using a first-then board to walk the patient through what is going to happen now and then what will happen next. If possible, a checklist of steps could also be very helpful. Just like you saw earlier, write the steps down on the whiteboard and then cross them off as you go. Some autistic patients may not be able to recognize representations of emotions. The Wong-Baker Faces Pain Rating Scale may not be an appropriate measure of pain in the patient. Also, know that some autistic people's experience of pain may be different. You may see different responses to pain than you might expect, like laughing, singing, or humming. Anticipate that, no matter the age of the patient, there is the potential that they may have ingested something that is harmful to them.
When working with an autistic patient, please be aware that they may be echoing your words in response to a question. For example, If you say, "What hurts, your arm or your leg?" the patient may reply, "Leg," because that is the last word that you said. To confirm a response, try repeating the same question with the choices flipped. If you then said, "Okay, what hurts, your leg or your arm?" and the person again replies, "Leg," that's a helpful clue to confirm that the answer is not an echo. During your work with the patient, you may see stimming or self-stimulatory behavior. The patient may be making noises, rocking, jumping up and down, or playing with a toy or object. As much as possible, do not limit the person's stimming, because this can take away their coping strategy. If the patient has something in their hands, like a toy, a string, or any other safe object, do not remove it. And if the patient does not have something to fidget with, consider handing them a sensory toy, like a squishy ball or a fidget spinner. This can help to calm and distract the patient. If you have to provide directives to the patient, always frame them using positive language. In other words, don't say, "Don't hit your head." Instead, try something like, "Have safe hands." Also, try to give choices as much as possible. Having some control of the situation can be incredibly beneficial for anyone during a stressful event. For an autistic person, choices can be a powerful tool for de-escalation. Even something like, "Should I check your right arm or your left arm first?" can be empowering to the patient.
In the event that the patient has or is having a meltdown, here are a few things to know. First, know that a meltdown is not the same thing as a temper tantrum, even though it may look similar on the surface. A meltdown and the behaviors that may come along with it are entirely out of the patient's control. It's not that they won't control their behavior, it's that they can't. This response is not their fault and is often brought about by one or a series of high-stress events. During a meltdown, if it is safe to do so, increase personal space around the patient. Do not crowd around or stand over the person.
Also, decrease the language that you're using. If you have to use language, be as calm, supportive, and reassuring as possible. Move any medical supplies or tools away from the person. Please assume, whenever working with an autistic patient, that they are at risk of eloping or running away at any point during their transition to the ambulance. Be extremely vigilant, as the patient may run towards a busy street or other danger without awareness of the risks of doing so. This could happen at any time during primary assessment, immediately necessary care, and transition onto the ambulance. Never let your guard down or assume that the patient will remain with a caregiver or first responder. If you've got extra responders on scene, use them for geographic containment in case the patient tries to run. They can create a safe perimeter.
Some patients may not know the purpose that the ambulance serves, or what will happen to them in that ambulance. Will they be hurt even further? Where are they going? Who is going with them? If there is a trusted caregiver or partner on scene, allowing them to ride in the ambulance with the patient can be a great way to alleviate some of that anxiety. They know that their trusted caregiver will be with them, and therefore that the experience will be safe.
Finally, consider doing a debrief after the transport. What went well? What might be done differently next time? What lessons were learned?
Okay, so let's review. 1. If a caregiver or partner is present, make sure they convey the person's communication style, triggers, and any helpful tools to calm the patient. 2. Make the experience as predictable as possible. Use visuals, like writing down a schedule or a first then, to help structure the experience. 3. Never stop a patient's stimming behaviors or take away their sensory tools unless the behaviors or tools are unsafe.
4. Provide choices whenever possible. 5. Use positive and supportive language. 6. Keep verbal language brief. And 7. Always anticipate and prepare for the possibility that the patient could elope at any time.
Using these tools and tips can make a significant difference to an autistic patient and their family. On behalf of the Autism Project and the Public Safety Special Needs Coalition, I want to thank you for taking the time to learn about supporting your autistic patients.